Welcome to the Brain Health Hookup. I'm Laurel Myers Hurst, your resident groovologist, and I believe that better mental health needs to be fun. Here we talk about mental wellness, we explore the physical, emotional, and relational needs we have as humans with the science and practices that help our mental health to flourish. Plus, we dive into my signature method, groove therapy, that engages folks in groove-based music making to lift mood and lower inflammation and pain. I'm so glad you're here. So let's hit it.
Well.
That's a deep subject.
I'm going to talk about 5 things you need to know about how your heart and your brain are different. That might seem like a no-brainer, so to speak. Your heart is definitely in a totally different location than your brain. It has a totally different function from your brain. But in physical medicine and in psychiatry, I feel far too often we treat the body as if the heart were the end all and be all for everything. And that's a problem. I want to let you know why. So, you know that one of the most common ways to measure the health of your body is to measure your blood. Interestingly enough, most of the factors we measure in the blood measure how the heart responds to that. So the minerals that are there, the amount of inflammation that's there that we measure, all these things are in relationship to whether they do or do not negatively affect the heart. The brain isn't really under consideration in these numbers because the brain's a little bit of a mystery still, I'm not going to lie. The problem with measuring the heart as the standard for health is that the heart has a very privileged position in the body, and it has earned it. The heart will work when everything else fails, right? Your kidneys can be shut down, your liver can be on its way out, even your lungs can stop working, and your heart will still lub-dub, lub-dub, lub-dub until there is no energy to do its job, no blood to be pumped. It will keep going. We want it to, right? That heart has to go with no thought or no control on your part every single day until the last day of your life. So the heart is a champion. But the problem with using the heart, and especially the blood and the needs of the heart in the blood as a standard for health for the body, are really problematic because your heart also has a very privileged position. Your blood will optimize for the endurance and safety of your heart. So even when you have times of low nutritional intake, your body will pull nutrients into the blood to make sure the heart is nourished. That's a feature of your body called homeostasis. Your body is always trying to idealize and equalize things so that you have the best chance of survival. Your body knows what your heart needs to stay alive. It will strip components you need for other tissues to enter the bloodstream to keep your heart pumping. So when we measure your blood, the serum specifically, the last place that deficiencies will show up is in the bloodstream. Your body's already trying its best to keep high quality nutrition and energy in the blood to directly feed the heart. There are no go-betweens, right? It's your blood vessels directly wrapping around your heart. There's no intermediary step. There's no making up for a loss or a lack. So your body keeps your bloodstream in homeostasis to benefit your heart. You want it to do that. What's that mean though? All of your other tissues could be starving and often are, and your blood doesn't show it. The problem with that when it comes to psychiatry is your brain is your fair weather friend. So In times of dehydration, your heart keeps pumping. In times of malnutrition, your heart keeps pumping. In times of high inflammation, even outrageously high inflammation, your heart will pump as long as it can. High blood pressure and stress, your heart will keep going until it can't go anymore. Your brain, not so much. A little bit of dehydration, it will conk out. Even a little bit of dehydration can cause a 25% decrease in your cognition. A little bit of malnutrition, meaning less than optimal nutrition, your brain will conk out. Brain fog. A little bit of inflammation, your brain's not having it. If your blood pressure is high, headaches and other effects, and in times of stress, depersonalization, derealization, other problems with mood, how we think, feel, and act in times of stress. So I do call the brain the fair weather friend of the body. How this affects how we care for people who come to us with problems with how they think, feel, and act. One, we just can't use the same standards for nutrition and inflammation that we use for the heart. If normal inflammation, normal low-risk inflammation for the heart is at this level, the brain kind of has to be here. If optimized nutrition for the heart is here, the brain kind of has to be here. So we need to measure those things with the brain's optimization in mind rather than taking into consideration the quote unquote normal lab values that are really looking at your heart. If you have been told that your lab values are normal, even though you can see they're at the tops or bottom of the range of the normal figures, I'd love for you to talk to your provider about that or seek an integrative provider who might have more information about the optimal levels of inflammation and nutrition for the brain. Remember, your brain is your fair weather friend. Dehydration, nutrition, inflammation, blood pressure, stress, it's going to conk out long before your heart.
Thank you for tuning into this episode of the Brain Health Hookup. I hope this episode radiates with the conviction that generating mental wellness needs to be fun and safe. We want you to find your power and understand your innate design to flourish in everything you do. And we hope that inspires you to come back and listen for more. I'd love for you to leave a review of this podcast as it helps the show grow to reach more people who need to make mental wellness fun. You can find a leave a review button as well as all the YouTube visuals, bonuses, and ways we can help to support you on our website, podcast.grooveforhealth.com. I appreciate you more than words can say. See you next time, and remember, together we have everything we need.